When we discuss the anatomy of the respiratory system, it's helpful to kind of look at this exact perspective, where we're looking at the anterior perspective of the lungs, and that we're looking at a lateral perspective of what we call the upper respiratory tract. So it's kind of divided into the lower respiratory tract, which should be kind of from the larynx down, and the upper respiratory tract, which is sort of what you think of as your, nose, mouth, and throat. When the person turns their head to the side like this, then you're able to pretty much get a good perspective on just about everything that you need to know. We have our nasal cavity, we have our external nares, N-A-R-E-S, also called the nostrils. There are also internal nares, which are sort of at the back of the nose here. It's also worth taking a note of these guys here, your nasal your nasal conchae. I could not remember the word for a second. I apologize. Your nasal conchae, which are in the lateral edges of the of the nasal cavity. It's quite late at night. Sorry, it's quite late at night for me. Okay. So then we have our oral cavity, of course, and then we have the pharynx at the back here. There's actually three parts to the pharynx. There's the nasopharynx, which would be the portion of the pharynx just behind the nose, posterior to the nose. We have the oropharynx, which we investigated with the digestive system, which is posterior to the oral cavity. And then we have the laryngopharynx, which sort of extends down into the larynx here. Now, let's take a close look at this. Let's take a close look at this little interaction here. Quite important. It's not really labeled in this picture, but you can see it. The posterior portion here of the throat, if you will, this posterior portion here is actually your esophagus. The esophagus is a collapsible structure that's soft, and it is a long tube that, of course, extends all the way down to the stomach. It punches through the diaphragm here, and it punches through into the stomach, which is just inferior to the diaphragm. And although the lower part of the esophagus is not shown, it is important to note that it is here, because anterior to the esophagus, you have the trachea, which is spelled here. The trachea, you can actually palpate this in your own throat. It's the ringed structure that you can, ringed hard structure that you can feel the actual rings. And these would be cartilage. This would be hyaline cartilage that surrounds at least the anterior portion of the trachea. Now, the esophagus is soft, and it collapses into the back of it basically collapses in on itself until you swallow something. When you swallow something, then you see right here, this is your epiglottis. It's going to cover this hole, which is called the glottis. And when you swallow, it's not going to allow that food into the trachea. Instead, the food is going to be forced back into the esophagus, which is going to expand forward into the trachea for just a brief moment of time. So the trachea actually is a structure that is soft. Let's take a look at like an anterior, like a superior structure of this. Here is a cross section of the esophagus, and here is the trachea. And as you can see, as we've been suggesting, there are these rings that make up the walls of the trachea. Here's the lumen of the trachea, and you can see, of course, that it's mucosal. No surprise here. You have mucous membranes lining the trachea all the way down through all the passageways, which we're going to be exploring in just a moment. So anyway, it's mucosal. Anyway, the posterior edge of the trachea accommodates the esophagus. When you swallow food into the esophagus, it actually pooches forward into the trachea. So when a person unfortunately swallows something, and starts to choke on it, it's not always the case that it has entered into the trachea. It's oftentimes the case that they actually did swallow it correctly. However, it never made its way all the way down through the esophagus, and instead it's punching forward into the trachea, and therefore the person cannot breathe because of that. So, all right. So that's the interaction of the trachea and the esophagus posterior to it. Again, taking a look at here, it's just hinted at. There's your esophagus in the posterior edge, And here's your trachea anteriorly. This is a figure that shows the nasopharynx, oropharynx, and the laryngopharynx. In this picture, I'm not sure there's a lot of detail. There's a lot of detail in this picture, however, it's not a lot of detail that we necessarily need to know all of these structures. The epiglottis is labeled here, which is helpful, and again, we have a pretty good perspective here of that esophagus and the trachea anterior to it. Here, we do have your nostril labeled here. When we take a look at the trachea itself, at the larynx itself, the larynx is a kind of a complicated mass of about 9 different cartilages that sort of wrap around each other. The two that we're actually going to be learning, though, are the thyroid cartilage and the cricoid cartilage, or the cricoid cartilage. So let's see where we can take a look at this structure that is showing all the things that we want to show. We'll be taking a look at this in the lab as well. In the lab, we're going to be taking a look at some figures that show this stuff. In this perspective, I'm really only seeing the thyroid cartilage labeled here. The thyroid cartilage is going to be the largest of the cartilages, so it really stands out. It's called the Adam's apple as well, especially in men where it's enlarged. It tends to be enlarged in men. The cricoid cartilage wraps all the way around and is sort of like the second largest of the cartilages of the larynx. So that kind of stands out. So we have a lot of models representing the larynx, and we're going to be taking a closer look at that. This particular picture has, again, a lot of details we don't necessarily need. However, there is something kind of cool that we do show in this figure that I want you to take a closer look inside of those models and see if you can really find these. We have vocal folds, which are also called vocal cords, or in this case, the true vocal cord. And then kind of superior and slightly lateral to that, we have a vestibular fold, which is also called the false vocal cord. So when we look at the trachea when we look at the larynx from this perspective, we can see both of those folds. Now, if we were to look at the larynx from above, from a superior perspective and down into them, you would see it like this. First of all, here's your glottis, the opening. Here is your vocal fold, and here is your vestibular fold along the lateral edges and slightly superior to that. So I want you to be able to see this from multiple perspectives. The models we have of the larynx are really good ones that you can kind of pull apart and look at them. But I do want you to know this level of detail. I personally think it's important. Obviously, this is the way that we produce sound, which is an interesting phenomenon biologically, and it's of interest to many, many different people. Communications majors and music majors, of course. You want to be able to understand how sound is produced, and it's literally produced by twanging this structure here, the true vocal fold, and sometimes starting to bring in those vestibular folds as well to augment the sound. Kind of an interesting perspective here is the epiglottis. It looks a little bit different in the models that we have, but what it is, again, is that flap that allows you to have a closure of the glottis, this hole in the middle here, to make sure that food is not actually passing into passing directly into the glottis or into the trachea. You want food to be going down the esophagus instead. All right, so that kind of takes care of the upper respiratory tract. There's a few things to take a look at in the lower respiratory tract. Of course, we have the trachea here. The trachea then divides into main bronchi or primary bronchi. We have a left primary bronchus here. We have a right primary bronchus here. You'll notice, which is kind of interest here, the left primary bronchus kind of extends more of a 90-degree angle away from the trachea, whereas the right primary bronchus, which is not actually labeled here, but there it is, it is labeled in this figure up here, the right primary bronchus. The right primary bronchus is more of a straight shot down the trachea. So if a child unfortunately aspirates, like for example, a stick and breathes it in, it's very likely that it would be lodged into the right primary bronchus. Okay, from the primary bronchi, we have secondary bronchi, and those are labeled here, and they're not actually labeled well in this particular figure, but we have them. In a general sense, there's going to be basically a secondary bronchus extending to each of the different lobes. So let's take a look at the lobes. And then we have tertiary bronchi that are going to be branching from the secondary bronchi, and so on. You'll notice that there are 3 lobes on the right side and that there are 2 lobes on the left side. On the left side, we have the superior lobe and the inferior lobe. And on the right side, we have the superior, inferior, and then the middle lobe of the right lung. So make sure that you know all 5 of the lobes. In other animals, they will have varying numbers of lobes of the lungs. But surgically, this is of interest to us. If, for example, you find a cancerous tumor, it's possible that you might be able to simply remove one lobe. If the cancerous tumor can be localized to one lobe, then that's a possibility. So there are surgeries done of this type, and you could even remove an entire lung, like the left lung or the right lung, and you would still have functionality of your respiratory system. You'll notice, of course, that there is sort of an accommodation place for the heart to be placed, and that does pooch into the left side, which is one of the reasons why it is that there's only 2 lobes on the left side and 3 on the right. There's just a little more tissue on the right side. There's a little more room over there.